Well, good afternoon. Over the past few weeks, thousands of people have stepped up. This crisis has brought out the best in all of us. And those on the front lines of this fight, those who are protecting the most vulnerable in our long-term care homes, in our seniors' homes, in our group homes, and women's shelters. They are the true heroes. And in recent weeks, we've done everything we can to get more resources to help these heroes. We've been working hard to get more boots on the ground where they're needed most. We've been working with our hospitals, our volunteer groups, and our men and women in uniform to get more support where it's needed. And now we're getting even more partners in this fight. We recently passed an emergency order to allow education workers, including custodians, cleaners, education assistants, social workers, and administrative staff to volunteer in the fight against COVID-19 and support our frontline workers. We put out a call to our education workers to come to the aid of our hospital staff, our long-term care homes, our retirement homes and group homes, our homeless shelters and women's shelters, and other congregate care facilities. And our friends, the response has been overwhelming. Our school boards, our trustee associations, and union representatives have all come together to support this framework. They're working with us to redeploy education workers who are not currently involved with at-home learning. They're working with us to get these workers into the fight against COVID-19. I want to thank our incredible, and I say incredible, education workers for their leadership. They're absolute champions. You're setting a great example for others to follow. My friends, this period has been difficult for all of us, but through it all, what keeps me going, what has been inspiring to see, is people stepping up. People from every walk of life, from every corner of this province, looking out for each other and doing their part in this fight. And this, the Ontario spirit, is what will get us through this. Thank you, and God bless the people of Ontario. Now I'll send it over to Minister Lecce. Thank you.
Well, good afternoon. The COVID-19 outbreak has been a difficult time for all Ontarians. But as Minister of Education, I can tell you that this crisis has also brought out the best in many students, in many educators and staff, and in all of our communities. In this moment of adversity, we are reminded by the overwhelming spirit, the resolve and grit of the people of this province to persevere. My colleagues, Dr. Marilee Fullerton, Ontario's Minister of Long-Term Care, and the Deputy Premier and Minister of Health, Christine Elliott, have made clear the continued staffing challenges during COVID-19, a challenge for this province and respectfully a challenge for all provinces within our country. We need people to step up and continue to step up in a big way, to be brave, to be compassionate, and to serve. And that is why we are here today. Following constructive and intensive negotiations, I'm pleased to announce that the government, in partnership with federations and school boards, have agreed on a framework that will enable the voluntary redeployment of staff within the education sector to assist our most vulnerable. Voluntarily redeploying staff from our schools into long-term care homes and seniors' homes, women's shelter, abuse centers, to provide the care these public servants demonstrate each and every day in their careers. Available positions could include custodial or maintenance roles, children and youth service workers, social workers, and educational assistants, among others. And we're asking all of them to consider, knowing that they will be fully trained, that they'll be provided with PPE, and that they will continue to maintain their employment relationship with the school board. I'm also excited to report that the first redeployment is currently underway in the province of Ontario. As we speak, QP education workers have voluntarily stepped up with their local school board to help in hospitals in Kenora. We are all grateful. Nous sommes reconnaissants. This week, the government will be launching a portal for education workers to submit their interests in concert with their local board. The portal will match their skill set with opportunities within their communities. And I want to just build on the Premier's point and on the Deputy Premier to just express our sincere appreciation to the Ministry's many partners for making this framework agreement possible. And I believe it will help save lives. Thank you.
We'll go to the phone line for questions. Just a reminder, one question, one follow-up, please. First question.
Your first question comes from Cynthia Mulligan with City TV. Please go ahead.
Hi, Premier.
Hi, Cynthia.
Today, your government said that it has an emergency order so that it can take control of long-term care homes that are struggling with COVID-19. My question to you is, why has it taken your government so long to issue this order when BC did it right out of the gate? And it seems that your government has been slow to respond at every turn to this crisis.
Well, we're going to respectfully disagree about slow to respond. We're responding rapidly day by day and through the advice of our Chief Medical Officer. But to answer your question, I'll pass it over to the Minister of Health. Thank you.
Hi, Cynthia. We're taking this action today because up until now, it really hasn't been necessary. We've had incredible cooperation with hospitals, with long-term care homes, and with public health units. We've had hospitals go in willingly with the consent of the management of the long-term care homes to provide assistance and in some cases to provide some supervision. So the making of this emergency order doesn't mean that we're going to do anything with it right now. It's just a tool in our toolbox to use if we need it so that we can move in rapidly if there's some care homes that continue to have problems and are resistant to having any assistance. Then we know that we will be able to get in there quickly because we want to save lives. It's going to be important for us to move quickly to help care for these very vulnerable populations. So it's happening naturally, but if we need it to happen quickly in a situation that's very dire for the residents of these homes, that's going to be a tool that we'll be able to use right away.
Thank you. My next question is for Education Minister Stephen Lecce. Hi, Minister. It seems if custodians and other staff are being deployed to long-term care homes, that they wouldn't be around to potentially open schools in June if that was going to be your order. Can we read into this that schools will not be resuming come June?
No, thank you for the question. I wouldn't read into that at all. I mean, the government is going to be making that decision known following the advice of Dr. Williams, the Chief Medical Officer of Health. I'll be reaching out to the leadership of Sick Kids this week to get more perspective on the way forward. But the Premier, I think, has been extremely clear and unequivocal. Safety is this government's guiding principle. Given that we closed schools, the first in this country, that's going to inform the next step with respect to the remainder of the school for this year. This redeployment is voluntarily. It can be terminated at any point by the employee or the employer. There's latitude given there. And they know for many of these workers, some of them could have been laid off, vocational teachers, some of them could be staff that are underemployed and seek additional employment. So this is a choice they will make. But obviously when it comes to for teachers who are eligible, although this program is maybe more focused on the education worker and component of our staff, that they know that their responsibility is the continuity of learning to their students. But we're encouraging folks to step up. And for those that can, they should. Because as we see in Kenora, there's a great amount of work being done by QP staff within hospitals in that community. And that work is, I think, making a difference. And so we think this is absolutely manageable. And we just want to get more Ontario public servants into these homes and centers to provide the care that these citizens deserve.
Next question.
Your next question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier Ford. This question might actually be better answered by the Minister of Health.
Great.
Minister, you just said a minute ago that this is another tool in the toolbox, this order that was issued this morning in regards to long-term care homes, and it will only be used if homes are resistant to receiving help from the government. I'm wondering if you are receiving, maybe a lack of cooperation in some parts of the sector or from some of these homes, and if there has been resistance to some orders from the government from long-term care homes thus far.
I would say that overall, the level of cooperation has been terrific, that the long-term care homes have seen an increased reduction in staff. Some of them have become ill themselves. Some of them, because of COVID-19, have gone away temporarily, but their cooperation with particularly hospitals coming in to help them has been great, and working with the public health units. However, that being said, if there are situations where it looks that they are going to need help and they are resisting help, we do need to have the ability to go in there quickly, because we know that the situation for residents can deteriorate very quickly. We need to make sure that there will be staff there to feed the residents, to help them make sure that they're hydrated, make sure that their basic hygiene needs are being attended to. So this is something that we have to be proactive. Should we need it, we will use it. But so far, there has been great cooperation, and it's our expectation that that will continue.
Next question.
And
oh, sorry.
Minister, by way of follow-up, the order also states that it can the government could place a corporation in charge of some of these homes. I'm wondering, given the questions that have arisen throughout the pandemic about the role of for-profit homes and corporations in this sector, why the government would choose to word that order this way and potentially place homes in the care of more of these corporations.
Actually, what we would anticipate is that there would be more hospital involvement with long-term care homes. A hospital is a corporation as well, and so while that has happened in many cases voluntarily, hospitals have agreed to come forward and provide support to long-term care homes. That is the kind of corporation that we would anticipate would likely be involved should we need to move forward with this order.
Next question.
Your next question comes from Christina Tenelia with CP24. Please go ahead.
Hi, Premier. Hi, Minister. Premier, wanted to ask you about this report that likely effective this weekend. Golf courses will open, marinas, private parks and campgrounds, and that there'll be a loosening of restrictions for off-leash parks. Is that accurate? And if so, when will it be implemented?
Well, what I can tell you, Christina, we're putting guidelines together for areas of the population and companies and stakeholders to get ready. We aren't at stage one quite yet, but we're asking people to get ready for stage one.
Follow up.
Okay, thank you, Premier. My next question is for the Education Minister. Minister, you're aware, of course, of this motion from the TDSB in which they're requesting funding to help with the cost associated with remote learning, purchasing iPads, purchasing Chromebooks. They're seeking funding from the province to essentially backfill their budgets because they've had to use their budget to pay for these items due to COVID-19. Is that something you will support or help the TDSB with and other school boards who make this request?
Yeah, first of all, I just want to acknowledge the work that is being done in school boards across Ontario. These folks have worked very hard in the administration to really help transform learning in this during this outbreak by moving it digitally, and there's millions of students are benefiting from your leadership and your hard work, and so thank you to everyone involved. I obviously appreciate that during a closure period, both things could be true. You could realize savings during that period, and there also could be new costs coming online, especially as we look to prepare for the reopening of school for sure in September. And so we're going to continue to have open discussions and meaningful dialogue with our school boards, with our educators, with our parents who have, I think, borne so much of the responsibility over the past weeks. We want them all, and students as well, to have a say. But I guess what I can commit to today is that the Premier has been clear. We will do whatever it takes to ensure the safety of our people. Our kids come first. These are vulnerable segments of our population. These are our children and grandchildren, our nieces and nephews, and our commitment to them is absolutely clear. We will put the resources in place and the tools and investments required to ensure the safety of all staff, but especially of our kids.
Next question.
Your next question comes from Colin DeMello with CTV News. Please go ahead.
Hi there. Good afternoon, Premier. I just had a question about stage one and when we can actually enter it. The Chief Medical Officer of Health said yesterday that he doesn't feel like Ontario has met the threshold to actually enter stage one. There also seems to be a bit of a disconnect between what Cabinet wants and what public health officials want. So I'm just curious in terms of who gets the final say on reopening the economy. Is that going to be you or is that going to be Dr. Williams?
Well, we always follow the advice from the Chief Medical Officer and the health team before we move forward, and there's always proposals. But these are strictly guidelines that are coming out, and just getting people ready for the next stage, which will be stage one. We aren't quite there yet, but at least it gives people to prep, time to prep, and companies to prep, and stakeholders to prep. So when we roll out stage one, but we always listen to the advice of the health table.
Okay, and just to follow up on that, Premier, a lot of people are wondering whether your government actually has a plan here or whether you're kind of figuring things out as you go along. Is there a whiteboard somewhere in your office or maybe in this government that actually has a detailed plan to reopen the Ontario economy with some firm dates attached?
Again, we have a very detailed plan from stage 1, 2, 3, and moving forward from there. Very detailed and very vetted by many people. But to forecast where we're going to be in stage 3, it just wouldn't be realistic. I don't think Dr. Williams could tell you. I could tell you, but as soon as we find out, we'll let the people know. But it all depends on the numbers. If the numbers are going down and we see a downward trend, not just for a few days, but over a couple of weeks, then we'll be able to make a move. But just to reconfirm, we take the advice off the medical team.
Next question.
Your next question comes from Robert Benzie with the Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier. Yesterday you were saying that you hoped by this weekend perhaps all of the long-term care testing would have been done. So I'm just wondering, when will more random and widespread testing begin, outside of the congregate living settings?
Yeah, I'm confident it will get done, but I'm going to pass this over to the Minister. Thank you.
Hi, Rob. The testing in long-term care homes is going very well. We anticipate it will be completed within the next few days. A number of homes have already completed 100% of their testing, and we're well on the way to getting to the rest of the homes as well. So that's going well, but with respect to testing more in the general population, we will be rolling out a plan with respect to that very soon, because it's going to be really important as we open up parts of our economy that we do that surveillance testing in the community so we understand what the health impacts are. If there's any concerns with what has been moving forward with, we'll need to stop, reassess, and make changes from there. But you're absolutely right. The surveillance testing in the general community is really important as we loosen the bounds that have held back our economy. So we need to make sure that they work one with the other.
Thanks. And back to the Premier, we're hearing from the TTC that they're facing a $520 million shortfall by Labor Day, and won't be able to continue operations without federal or provincial support. The federal government is saying it's a provincial jurisdiction, so I'm just wondering, is the provincial government going to come forward with some kind of a bailout to help the TTC?
Well, we're looking at that, Robert. I had a meeting this morning with our team, also had an in-depth conversation with the Minister of Municipal Affairs. They're going to need our support, and we're going to be there. We're going to be at the table, but we can't do it alone. We need the federal government to support us. Just too big of a ticket, and I'm sure we'll be mentioning this on our weekly call with the other premiers as well, because it's very concerning. But we will be at the table for the municipalities. To what degree, we'll have to wait and see what the federal government comes up with, because it's going to be a big ticket.
Next question.
Your next question comes from Julianne Lemorex with Radio Canada. Please go ahead.
Yes, good afternoon, Premier. While we're preparing to reopen parts of our economy, are you going to ask Ontarians to wear a mask in public, or in all circumstances, or in certain circumstances? And can you make it mandatory?
Well, right now, what I'd like to do is, when possible, you could wear a mask or a face covering, the minimum, but I'm going to pass it over to the Minister of Health. Thank you.
Well, thank you. Our Chief Medical Officer of Health has recently released some guidelines for us to follow as we start reopening the economy. And what he has suggested is that if you're going to be in a situation where physical distancing is not going to be possible, and that may be in public transit, it may be in other circumstances, he would recommend that you wear a mask because it may not protect you from receiving COVID-19, but it will protect others from you, so that we want to make sure that we keep everybody as safe and as healthy as possible. So where physical distancing is not going to work, then yes, he would recommend a mask.
And as a follow-up, I would ask a question to Minister Lecce. Minister, your government has said that providing daycare will go hand in hand with parents going back to work, but at what phase of the plan to reopen the economy will daycare reopen? So at what stage of the reopening of the economy?
You know, we appreciate full well the importance of childcare and daycare to get parents back into the labor market, get them working. We hear families loud and clear. The objective now for the government, which is what we're doing, is in conjunction with the Minister of Health, working with the command table, the COVID-19 command table, under leadership of Dr. Williams, to come up with a timeline. And so the government's aim, the Premier, I think, made this clear some days ago, we want to provide that certainty, get that out to you once we have the plan endorsed by the Chief Medical Officer, and once that updated modeling can inform our next step. I guess what I can affirm to you is that we'll get that out in short order. Premier's been very clear that he wants to provide that certainty to parents in the labor market, to employers, and to communities. So we're going to do that, but I just want to make clear that all of our determinations for childcare, for licensed childcare, of course for schools, will be premised on the health and safety of our kids and of course on our staff.
Last question.
Your next question comes from Jacob Cape with Global News. Please go ahead.
Hi, Jacob.
Hi, Premier.
Hi.
The Prime Minister has indicated strongly that the Canada-U.S. border will likely remain closed to non-essential travel. President Trump, as you know, has indicated he would like to see trade resume sooner rather than later. Where does Ontario stand, and do you think the border needs to remain closed, and for how long?
Well, I want to keep it closed. I made it very clear on the call with the premiers and the Prime Minister. We need it closed. Now that excludes the trade back and forth. That's still moving back and forth. That's critical. But right now, and I always say we love our American neighbors to the south, but right now we're going to have to keep the borders closed, especially just for visits and that. We just can't risk it. And when the time comes, when we get clearance from our Chief Medical Officer and the health table, then we'll open our arms and welcome everyone around the world, but not right now. We cannot chance it.
Follow up.
Yeah, my next question is actually for Minister Lecce.
Yep.
The Premier said earlier this week that you would have an update on what's in store for the rest of the school year. Can parents expect an update this week? And if not, how come?
Parents could absolutely expect an outcome. We plan to do this by early next week, and really the reason why is because we're looking to updated modeling from the Chief Medical Officer of Health and the command table. You know, I just want to say I appreciate for parents out there, for educators, for the kids, that they want to know the plan, and they deserve to know the plan. The Premier, I think, has been unequivocal in getting it out. But our duty is to make sure we land in a place that is consistent with the values, I think, of families in this province, which is safety must come first. So we're doing that in real time. I'll also be informed by advice from other leaders when it comes to medical leaders when it comes to kids, including the leadership team of Sick Kids will provide perspective as well, among other inputs that we're seeking to make sure we get the right decision. But we can confirm that by early next week, that plan will be communicated to the public transparently, and we'll let you know both the decision for June as well as the intention to scale up in a significant way our learning program for the summer to keep our kids engaged in the curriculum and ultimately to mitigate from learning loss.
Thank you, everyone. That's all the time we have for today.
Great. Thanks, everyone.